And when did you get the diagnosis of the PDA?
About a week after they were born. They both had their breathing issues and other things that could have pointed towards them having a PDA, but it has to be a combination of things that let you know that you really need to look for it. And Maverick started having blood shunt into his lungs. And they called me and said that they would be surprised if he made it overnight. And they were doing scans and found out that he had a PDA, the hole in his heart. And because it's something semi-typical to have so early, they went ahead and scanned Everly and found out that she had one as well.
And Dr. Bocks, we know we can do some pretty crazy stuff through a cardiac cath in adults, valves, stents, things like that. But we're talking premature baby, tiny blood vessels. Tell us about the challenge that you had with this procedure.
Well, yeah, you mentioned all the difficulty that we have with this procedure. Their blood vessels are very small. Their hearts are about the size of a walnut. So it's a big difference between doing a catheterization even on a full-term infant or a young child or an adult compared to these premature patients.
And otherwise, this would have required a open heart procedure, correct?
That's right. The old way to do it would be to do a open surgery through the side and to the back and move the lung to the side. And these days they put a clip on it. The surgeon will put a clip on it and then they sew everything back up and the infant recovers after that. We're able to do this now just with a 1 millimeter nick in the skin down in the groin, put a very small catheter through it, and it's very minimally invasive.
How common is this condition?
Up to 50 to 60% of premature patients, especially the real young ones, will have a PDA. About 20% of those will have to have it closed, one way or the other.
And I want everyone to take stock of how amazing this is, because a premature baby, they can be fighting for their lives regardless, but the old big open heart procedure, to look at your babies, Jamie, and yeah, I know right now you're in a hospital setting, but they're at home with you now. They're doing well, they're thriving. And I think that speaks volumes about how these procedures can truly allow these kids to thrive. And I have to give you a shout out, Dr. Bocks, and your team, because I want everyone to really think about how difficult this can be to accomplish. And we know that you have a lot coming up, Jamie, raising your twins. So we reached out to UPPAbaby, and they're gonna set your whole family up with 2 Jordan Vista strollers and a rumble seat to convert the strollers from singles to a double, worth close to $2,000.
Wow.
Also, Hello Bello is setting your family up with a year's supply of diapers and a bundle of baby products from their line. Hello Bello was created by Kristen Bell and Dax Shepard with our executive producer, Jay McGraw, so you don't have to choose between what's best for your baby and what's best for your budget. And we just wish you nothing but the best, Jamie, moving forward with your beautiful twins. And once again, Dr. Bocks, thanks so much.